Good evening. This is the first online presentation among a group of presentations talking about vocology. My name is Professor Dr. Ahmed Rifat. I'm an assistant professor of phoniatrics, otorhinolaryngology department, Faculty of Medicine, and Shams University, Cairo, Egypt. Today's presentation is about ultra-high-speed laryngeal examination. So, what is high-speed laryngeal examination? High-speed camera is a device capable of capturing moving images with exposure less than 1 over 1000 seconds. Normal motion picture is played at a rate of 24 frames per second, while high-speed camera can examine the larynx at a rate of from 2000 to 4000 frames per second, giving such remarkable details of glottic waves. Uh, Unlike laryngeal stroboscopic examination, which is simple artificial light fired according to frequency of patient's voice, a stroboscope, also known as the strobe, is an instrument used to make a moving object appear to be slow moving or stationary. It consists of a rotating disc with a lamp, such as a flash tube, which produce brief repetitive flashes of light according to frequency of patient's voice, just like discotheque. So it's different from in real light, not artificial light. As we can see in this case, this is a unilateral vocal fold immobility, and you cannot see in the strobe light, you cannot see any waves, unlike the previous picture. Stroboscope is an artificial light. We cannot get real numerical data from it. Stroboscopy depends on frequency. So, in all cases that frequency is affected, the larynx will not elicit strobe movement, such as glottic gap, or aphonias, masses, many function disorders. So, what can I get from high-speed laryngeal examination? First, you can get real-time actual vibratory pattern from initial examination and for follow-up either post-treatment or post-intervention. Here, this is a case of uh, unilateral vocal fold immobility before voice therapy, and we can see the large glottic uh, gap and asymmetry in vibration between the right and left side before therapy, and after therapy we can see how voice therapy maximizes the aerodynamic effect of the subglottic pressure, improving closure and improving voice. Here is another example of pre-intervention. This is a case of spasmodic dysphonia pre botulinum toxin injection. We can see short glottic wave, long phonation time, while after 3 days of injection, we can see the glottic waves return to normal, and we can see the normalization of the normalization uh, of a mucosal wave and the opening and closing phases. Also, we can get numerical data, objective numerical data from it using digital chymographic examination the along all uh, along the vocal fold. Here, in this case, is a case of an intracaudal epidermoid cyst. We can see the fixation of mucosal wave on the site of the cyst, causing maximum impairment of aortic wave and causing maximum dysphonia. Again, this will not will not show any uh, findings or any waves uh, in stroboscopic light. Uh, Also, we can get help detecting mucosal affection. Strobe loses its function once there is marked dysphonia, either by mass effect or affection of mobility or the presence of gap. Unlike high speed, here we can see a superficial mass involving the free edge but not fixing mucosa on the left side. So we can see that still there is mucosal wave affected, asymmetrical, but there's still waves. Unlike this case, here we can see the fixation of mucosal wave. Notice the difference between the previous slide and this one. There is immobility, but also there is fixation of the waves. There is no waves on the left side. So, is it a perfect device? Of course not. High-speed laryngeal photography have the following drawbacks. Uh, it's in lower resolution. Usually, strobe can reach high definition, while in high speed, it's a maximum 256 pixel. In order to save about from 4,000 to 16,000 frames per second, high disk storage is needed, about 450 megabytes for each patient, which need a lot of storage. Uh, so this is the main drawbacks of this device. Thank you.